So the Wells score is a predictive model to help primary care physicians and emergency room physicians determine if an ultrasound is necessary. What it does is it asks a series of questions. It counts up points based on the answers to those questions. And then based on the number of points, it is a low, medium, or high probability for a clot. Based on that, then it helps the patients. So if the patient has a low probability, you're then asked to do a D-dimer, which is a breakdown product of blood clots. And if that is normal, then it excludes a blood clot, saving that group of patients from an ultrasound. If it's a high risk, you don't need to do the D-dimer. You can just go right to the ultrasound because you wouldn't trust the D-dimer to exclude that. And so what we find is that the American Society of Family Physicians and emergency room physicians still endorse this, the use of models, especially in patients with their first suspected DVT. But the reality is that when you look at the reviews of all the people that get ultrasounds, they go retrospectively and say that most patients don't even have those questions answered. Not only do they not have the questions answered, there's no Wells score. And so a lot of times people default right to the ultrasound. And so even though this model is endorsed, it's very rarely used. So when the patient comes to us for a DVT, it is because a primary care physician or some other provider has determined that they need that ultrasound. So we get an order to do the ultrasound based on their assessment. What would be interesting to do is see how many of those people are actually following that model. What I do when I do my lectures for the primary care physicians, and we have one coming up in November for a PA organization in the area, is we go back through that Wells model and we actually talk about that because that is the most validated model. It's just not being used in clinical practice. So we don't do that because we are receiving the patient after that has already been considered.